the situation with Rice was that it was such a weird play. It was such a weird injury. Usually, if it's a full thickness ACL, you know within a couple hours. Like it's straightforward. I mean, the media knows within a couple hours. When you hear coach say something along the lines of what he initially said, you knew it was kind of bad. And he's usually pretty straightforward. Some of the other ones are not. But in general, then you have all the different media people kind of chiming in, and some ones are better than others. Um, but usually, the fascinating thing about this was that Rappaport and Schefter had two different takes, which is rare. Like that's really rare. They're almost identical, and then Jordan Schultz is usually kind of like there as well. So, but it was like they all had different information, which was super weird. And most of the time, it's straightforward. They know to an extent if he's going to come back. I'm assuming his knee was relatively stable, um, and and that's why they were so up in the air with it. The MRI is usually pretty straightforward and clear. The fact that they were still like, and he was walking around like, hey, he's just wearing a sleeve. I don't know how true that was, but I'm assuming it was relatively true. Um, can't you still walk around with a partial ACL tear? Yeah, I have a couple guys in the NFL that have partial ACL tears that are playing that I've injected. So yes, you can do it. It's possible. Usually, his knee was really swollen per se, and that's not surprising. But his injury was so uncommon, so unconventional. I'll walk you through it real quick just because I have my knee model here. Traditionally, we get tackled on the outside of the knee, the inside of the knee collapses, and the MCL here and the ACL, which is deep, get torn. That's pretty standard, pretty common, unfortunately. Why? Because this is the outside. Most people don't tackle the inside because the other knee's there. Well, this weird situation with Mahomes, he kind of hit him straight, but on an angle towards the medial or inside. So the outside took all the force. So that's why the LCL here, the hamstring tendon, which comes down here, and then the posterolateral corner, which is all this stuff. And there's more to it. They don't show it on the model. That's why that was affected. He got lucky in that his ACL wasn't compromised. It's probably stretched a little bit fine. The PCL is probably stretched. That's fine too. But just the nature of the angle, it was weird. I was just a little surprised they didn't say, yeah, the ACL is fine. I mean, even on an MRI, they usually can say with pretty good certainty the ACL is fine, PCL is fine. Yeah, there'll be swelling everywhere. The signal's usually fine. Okay. But they had to go in and scope it and then kind of go in and say, yeah, this is fine, this is fine, this is bad. And then they realize, hey, yeah, we need to reconstruct the LCL and the hamstring tendon, which is a little surprising. And then probably some other smaller little ligaments and tendons in the posterolateral corner. I wouldn't say the whole thing. I mean, there's a lot of parts to it, so I doubt he did the whole thing, and we'll never know. We don't really need to know per se. The good news is he's young. He's got a pretty clean bill of health. Besides this, he's stabilized. He saved his ACL. He didn't have any bad meniscal tearing as far as we know. I'm assuming he didn't because they would have probably mentioned it. But the problem with the LCL is it's such an important rotary or twisting of the knee, rotating of the knee. And there's all these little mechanisms on the outside, not in the joint, on the outside that rotate the knee. And that's what the posterolateral corner is. It's such a rare injury. We really don't talk about it a whole lot because you just don't injure it. It's not commonly injured. The only guy that comes to mind that had this is J.K. Dobbins, and his was a contact ACL, which is again rare. That doesn't happen, about 25%, if that. And he's looking good this year. He had the Achilles, which is even crazier. So will he maybe lose a little bit of his twitch, of his quickness? Maybe, but if this would have been much, much worse if this was ACL, I will say that. So if he loses a couple percent, you probably can't even appreciate it. It's just one of those things that it's just not a big deal. It's just an unfortunate fluky injury, and there's nothing else you can say about it.